Bismillahirrahmanirrahim. Today we will have case quiz number 21. Case data: 45 years old man. History: fell from his bicycle and sustained a fracture of his distal radius. Fracture healed appropriately with immobilization. However, the patient noted that once the cast was removed, his wrist was sore and stiff. This was deteriorated over a number of weeks, such that his whole hand became painful and swollen. Examination: the pain doesn't localize to the joint in particular, and indeed the whole hand appears generally hypersensitive. The skin is shiny and purple and disproportionately sweaty compared to the unaffected side. So, what is the diagnosis? The answer is this is a pure orthopedic case. It is not a rheumatology case, but you may be faced with such a case during, for example, rehabilitation after cast removal. So the case is yes, reflex sympathetic dystrophy. Reflex sympathetic dystrophy. Reflex sympathetic dystrophy. This is a classic description of regional pain syndrome, also known as chronic regional pain syndrome (CRPS) or reflex sympathetic dystrophy. The condition classically occurs after injury and is characterized by the rapid development of extreme pain that is out of proportion to the initiating event and doesn't follow an anatomical pattern. In addition, there is considerable swelling, and the skin may display trophic changes including increasing sweating. Vasomotor instability is also recognized. Appropriate investigations would include C-reactive protein and/or ESR to rule out an underlying inflammatory arthritis. X-ray features very early on disease are normal. So the X-ray may be normal in the early case. With persistent disease, the most notable findings are soft tissue swelling and patchy osteopenia, in the X-ray. Thermography is a specialist investigation and has high sensitivity for thermal changes in the affected limb. Although there is no specific treatment for chronic regional pain syndrome, prolonged rehabilitation with intensive physiotherapy can be very effective. Other treatment options for resistant or severe disease include neuroleptics like gabapentin or local sympathetic nerve blocks. Key points: consider CRPS, complex renal pain syndrome, in any patient presenting with an isolated painful limb following injury. Trophic changes and vasomotor instability may help to differentiate CRPS from an inflammatory arthritis. And finally, thank you very much for your attendance, and we will meet you in the next future with case quiz number 22. Wassalamu alaikum wa rahmatullahi wa barakatuh.